For Action News, I'm Mana Delaski. Here at ACTIA, we're fortunate to have Dr. David Schlaze, one of the world experts on antibiotic research and development, as our advisor. Dr. Schlaze has been intimately involved with the FDA, which he has both criticized and worked with, trying to prevent us from entering a pre-penicillin age where effective treatments for bacterial infections don't exist. His latest commentary discusses a recent op-ed in the New York Times by Newt Gingrich, in which he proposes doubling the budget of the NIH so that more research can be done in several disease areas. We spoke with Dr. Schlaze, and he points out one glaring omission in that proposal.
It's clearly an important problem. I mean, there are 2 million antibiotic-resistant infections occurring in United States hospitals every year, leading, according to the most recent data from the CDC, to 23,000 deaths. It costs us something like an additional $20 billion in direct excess additional healthcare costs every year, and an additional $35 billion in costs related to loss of productivity. The other issue, of course, gets back to this op-ed by Mr. Gingrich, Newt Gingrich, where he suggests that we simply double the budget of the National Institutes of Health, which I think would be a great idea. But of course, what he wants to do is he wants to get more funding on research in things like Alzheimer's disease, diabetes, strokes, kidney disease, cancer, arthritis, which are all great. But they've been getting lots of money from the NIH, or at least a lot more money than antibiotic resistance, forever. So we're caught in this cycle where we keep not funding it. We keep discouraging people from going into research in antibiotics. And then when we get poor grants, we say, oh, these guys just don't know what they're doing. But I mean, it's our fault. It's totally our fault. The other thing that a number of us have been after the NIH to do is to provide at least some money, and this would not be very much money, to train investigators so that they knew what they were doing in terms of antibiotic research. And that effort has fallen flat. So, yeah, I agree with Mr. Gingrich that it would be great to increase the NIH budget, double the NIH budget. I think we should think about antibiotics. And it's not like there's nothing in the antibiotic pipeline. There are some new antibiotics that will be coming out that I think will help tide us over. But we do need to get started on doing some new things. So number one, we have to get started on getting researchers involved in the field. We have to do a much better job than we've been doing. And two, we have to get pharmaceutical companies really back in the business of finding and developing antibiotics. And so far, on those two fronts, we're not doing well.
To read more on this topic, you can head to our website, actia.org, and while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox. For Action News, I'm Mana Delaski.